Welcome to my COVID-19 briefing for July 8th. I hope you all had a safe and enjoyable 4th of July. The 4th of July has always been one of my favorite holidays, and I was happy to see that so many people were able to enjoy this important holiday in a safe, physically distant way. This community has done a commendable job taking care of each other and working to beat COVID-19. These challenging few months have tested us, and we have shown ourselves to be resilient and resourceful. We have never lived through anything like this, but we have all adapted and been united in facing COVID-19. We know this would not be easy, but none of us knew how difficult it would be to deal with both the public health and the economic crisis at once. We have to remain committed and continue to face this ongoing challenge together. Beginning on June 26, the Washington State Health Secretary, John Weisman's order went into effect. The order states that every person in Washington must wear a mask. This important order is critical to beat COVID-19, and it's an opportunity for us to unite together to protect our community. The requirements under the order of the state is that every person in Washington State must wear a face covering in any indoor or outdoor space, including any building or business open to the public, in healthcare settings, in line waiting for public, for transit, for any vehicle for hire, any outdoor public area, including public parks, trails, streets, sidewalks, and other recreational areas where 6 feet of distance cannot be maintained. Businesses are now required to refuse service to those who are not wearing masks. Individuals may remove their face coverings under the following circumstances: while they're seated at a restaurant or an establishment that offers food and drinks, and if you're able to maintain 6 feet of separation; while you're engaged in an outdoor exercise such as walking, biking, hiking, or running, and you're able to maintain 6 feet of separation, except for those who play on sports teams. When in outdoor picnic public areas, when there's a 6-foot distance between non-household members. You may also remove your mask if any party to communicate is deaf or hard of hearing, and not wearing a face mask is essential for communication. When obtaining a service requiring temporary removal of facial coverings, when necessary to confirm an individual's identity, and when federal or state law prohibits wearing a facial covering. Children younger than 5 are exempt from wearing facial coverings. Children under 2 should never wear a mask because of the safety risk. However, children older than 2, 3, and 4 years of age should wear a mask under the close supervision of an adult when in grocery stores, pharmacies, or other places where social distancing may not be maintained. Persons of certain medical conditions, mental health, or disabilities may also be exempt. Masks are most effective when we wear them, and that is why this order is so important. We are all united in our efforts to beat COVID-19. We all want to see a safe, healthy community. We yearn to go back to a sense of normalcy. Wearing a mask will help us get to that point. Each step we take to beat COVID, backed by science and data, will be part of the solution in this public health crisis. Wearing a mask alone cannot stop COVID-19. The city has followed the guidance of the governor that the city's efforts should be aimed at educating our community on the many benefits of masks in fighting the pandemic. Rather than enforcement, our dedicated professionals and law enforcement are there to educate and inform our citizenry of this new order. We continue to remind all residents that face masks are now required whenever they're out in public. Not only are masks required, They are the right thing to do to protect our neighbor. Our police department will continue to prioritize this message and will carry this message out to the highest possible standard. We all have to play our part. We must wear a mask, practice physical distancing, good hygiene, get tested if you have symptoms. Wearing a mask is just part of our community's coordinated effort to beat COVID. While Skagit County remains in phase 2, we have a set of standards set by the state that determines our ability to move to the next phase. The Washington State Department of Health and Governor Inslee evaluate the county's ability to move forward based on 5 metrics. Metric 1, a county must have fewer than 25 new cases per 100,000 residents over 14 consecutive days. We have 53.4 new cases per 100,000 residents. Number 2, a county must have greater than 50 individuals tested per each new case during the prior week. We currently have 28.8 tests per each new case. Number 3, the percentage of individuals testing positive must be less than 2%. We currently have 3.5%. Number 4, the percentage of beds occupied in the county must be less than 80%. We are currently at 68.4%. And lastly, number 5, the percentage of those beds occupied by COVID-19 cases must be less than 10%, and we're currently at 2.3%. Based on the most up-to-date information, we are only meeting 2 of the 5 standards set by the state to move to phase 3. The Skagit County Board of Health met to give an update on Skagit's COVID-19 response and counts and trends, and at the time, the County Health Board made the decision that it will not be applying to move forward to phase 3 until further notice. We need to remain committed to all these categories in order to continue to move through the phased approach. And here in Anacortes, I believe everyone is taking this seriously and will continue to social distance, stay at home when sick, wash your hands, and let's keep up this momentum. Currently, our entire state has been paused in the Safe Start plan meant to reopen the economy. No one can move to phase 4. Rising cases across the state, concerned about continued spread of COVID-19 virus, has made 4, which would mean no restrictions, impossible at this time. 8 counties were eligible to move to phase 3, move from phase 3 to phase 4 before this pause. The state has made it clear that this is an evolving situation, and we will continue to make decisions based on data. We will remain in phase 2 until at least July 16th, at which point the Skagit County Health Department will once again review and see if we're meeting the necessary metrics to apply for phase 3. As a reminder, under phase 2, certain non-essential businesses reopen with restrictions. People are able to gather with 5 or fewer people who are not in their immediate households per week. Any gathering of more than 5 people is prohibited during phase 2, and those who belong to the high-risk group should continue to stay home as much as possible. The Senior Center, the museum, the library, the municipal court, and City Hall remain closed through phase 2. As we work to develop a plan for phase 3 reopening, in phase 3, when the city's facilities reopen to the public, they will have signs to indicate proper physical distancing, plexiglass shields, and some new procedures for in-service services. City Hall will see a limited reopening at the permit counter, in the finance department, and other in-person city services. The library and the museum will have limited in-person services, and we will see more reopening of parks facilities in Phase 3, as well as including playgrounds and games may begin on the ball fields. The Anacortes Municipal Court and the lobby of the Anacortes Police Department will also be open in Phase 3. The Anacortes Senior Activity Center will reopen in Phase 4. We will keep you informed about these changes as we move into Phase 3 throughout my community briefings, and on our website, we'll be posting signs at City Hall and via social media. We understand that some residents have been having financial difficulty paying their city utility bill due to COVID-19. We will be offering a payment plan soon and encourage you to continue to check out the utility billing webpage for information. Right now, there are organizations that are prepared to assist you with financial help. If you're worried about making a utility bill payment, utilize one of these community resources: the Salvation Army, Washington 211, or the Community Action, or your local church. Our finance department has begun working with other departments to update our capital facilities plan to identify the next 6 years of capital needs. The capital facilities plan amendment is out for public notice, which is along with another budget amendment that's scheduled for our council to look at on July 20th. We will also be reviewing and preparing for the implementation of the Affordable Housing Sales Tax that went into effect July 1st. We continue to operate under a great deal of uncertainty, and we are being proactive and fiscally responsible in developing our city's next budget for the year 2021. The Planning, Community, and Economic Development Department is hard at work finding ways to assist and partner with our local businesses, such as providing over 12,000 masks to local businesses in the coming week. The City Planning Commission is also excited to get back to work with virtual meetings this month, starting this evening at 6 p.m. You can watch it right here on Channel 10. Additionally, Resolution 2094 proposes an adoption of guidance to allow restaurants and retailers to expand use of the sidewalks and commercial avenues during periods when the street is closed to vehicles, potentially Fridays at 5 p.m. through Saturday at 10 p.m., to stimulate economic recovery in our community. Closing the street and the broader use of the sidewalk allows more area for physical distancing, an additional retail area, and more dining area while meeting safely with health guidelines. This, along with the parklets and streeteries that are arriving in August, will allow for an open-air experience on Commercial Avenue in our central business district. Also in planning, the number of permits are up when you compare this time to last year. As of right now, we have 8 accessory dwelling unit permits that have been issued this year. We've had 30 single-family residence permits, 74 single-family residential alteration permits. This year's total permits issued is 333, up slightly from 324 last year at this time. We are fortunate to have access to the natural beauty of Fidalgo Island, and as the weather gets nicer and some restrictions have been lifted, we have begun to see people taking advantage of our outdoor spaces. Use in our parks and our trails are up, with more and more people looking for ways to recreate while social distancing. This June on the Thompson Trail, we had 10,683 visitors, which was an increase of approximately 16% over last year. The Washington Park Campground is open, and we were completely full over the holiday weekend. The boat launch is also open to the public and is experiencing a significant traffic this last weekend. Please remember, the governor's order means that masks are mandatory in outdoor public areas, including our parks, trails, streets, sidewalks, and other recreational areas when 6 feet of distance cannot be maintained. I want to thank you all for uploading your family pictures to the City of Anacortes' 2020 Town Photo. While we celebrated differently this year, we have all shown that we can come together even when we're apart. If you take a look at our mosaic of pictures and zoom in, you can see your family and the families of your neighbors and friends as we all came together on Commercial Avenue. Are you signed up for summer reading at the library yet? If not, I encourage you to watch the recent videos on the library's website and social media. This summer, the fantasy world has gone virtual, and wizards and witches and dwarfs and princesses and more can be seen on Zoom meetings this week talking about our Anacortes Public Library's summer reading program. Sign up online, start reading ebooks immediately, or by picking up your holes at the library's ongoing curb service delivery, which takes place Monday through Friday from 11 a.m. to 4 p.m. The library staff is available by phone during curbside to help you with account questions and in reading recommendations each weekday. Make sure to watch our Public Works Director Fred and our City Attorney Darcy's scuba story time from last night if you haven't already, and tune in next Tuesday for story time with me. Don't miss this Thursday's Storytime adventure full of independent princesses, library magic, and of course, see the book lists and the new books of the library that are waiting for you to reserve and pick up. The Anacortes School District has already begun planning for several different scenarios for school to reopen this fall, including in-person, online, and hybrid models. Each model will depend on the guidance from the state and the local health officials. The district is engaged with community stakeholders in these planning efforts and will continue to keep the community informed. I, along with other leadership here at the city, will be serving on the school district's community stakeholder group as we plan for what is this upcoming school year and what it will look like. The governor indicated that in monitoring the state's health data carefully, we must proceed with caution. If COVID-19 cases spike or spread, the school district will be prepared for several different scenarios. BloodWorks is a regional nonprofit provider of blood components to over 80 hospitals throughout our region, supplying 95% of the blood in this region. Some of the hospitals this organization supports include Island Hospital, Skagit Valley Hospital, Seattle Children's, Seattle's Cancer Care Alliance, University of Washington Medical, and Harborview. With COVID-19 impacting our region, BloodWorks discontinued the mobile donation program through the end of August, which accounts for 60% of the organization's collections. There is concern that the organization will be able to maintain a stable blood supply this summer, so they're going to go out into the community and create pop-up donation centers. Anacortes will be the home to a pop-up donation center on July 14th through July 22nd at the Westminster Presbyterian Church in the Fellowship Hall. No walk-ins, guests and people under 16 are permitted, and all donors are required to wear masks or face coverings during their appointment. There is no substitute for blood, and BloodWorks Northwest relies on the 1,000 donors each and every day to fulfill our need in the community. So if you're able, please make an appointment to donate blood. Island Hospital has tested a total of 2,308 people with a total of 41 positive cases in our town, 9 positive hospitalized cases, and there have been no deaths. The outpouring of support from this community for Island Hospital during the coronavirus pandemic has truly been overwhelming. In addition to meals, cloth masks, and personal protection equipment donations, this community has contributed an astounding $674,000 to the COVID-19 Emergency Relief Fund. Because of your kindness and your generation, Island Hospital has 8 state-of-the-art new ventilators, tele-ICU equipment, telemedicine for specialty clinics, a CFAT machine testing cartridges for COVID-19 testing, 2 to 3 months of personal protective equipment, and training for redeployed nursing staff. The county has received questions about how long someone should wait to be tested if they think they've been exposed to COVID-19. If you're worried you've been exposed to COVID-19, you should immediately quarantine. After 5 to 7 days, you can go and get tested. You do not need an appointment or a referral. COVID-19 testing is available at Skagit Valley College, just east of McIntyre Hall, Monday through Friday between 9 a.m. and 4 p.m. The county is still in need of volunteers for testing at the college. Volunteers will be directing traffic, helping register people, helping testing. Shifts are available Monday through Friday. If you have questions or you're interested in volunteering, contact Tina Bobbitt with the Department of Emergency Management at 360-416-1853. Tina Bobbitt at the Emergency Management Department. Globally, we have 11.5 million cases. 535,000 people have died. In the United States, we're reaching nearly 3 million cases with over 130,000 deaths. In Washington State, we currently have had over 37,000 cases and 1,384 people have lost their lives. It's important now more than ever for us to come together, work towards the goal of defeating this virus so our families and our neighbors and our friends can be safe. So now I have 2 questions that were sent in. And question number 1, when can we move to phase 3? The governor's Safe Start plan outlines a county-by-county approach to reopening our economy. The Skagit County Board of Health determines if and when we are ready to apply for phase 3. They have determined that based on the case count and the case spread, we will not be moving into phase 3 for the time being. We need to focus on the 5 metrics the state has set and meeting those standards. Our County Board of Health will meet on July 16th to review whether we are meeting the standards and if we're able to apply for phase 3 at that time. Question number 2. Why did cases go up so much over last week? Currently in Skagit County, we have a total of 558 cases, 442 recoveries, 60 people have been hospitalized, and we've had 15 deaths. Skagit County Health confirmed today that there has been an ongoing outbreak at Mira Vista Care Center in Mount Vernon. So far, 21 of the COVID-19 cases that have been confirmed at the center. The first case was reported on June 19th, and follow-up testing discovered the additional cases. Fortunately, most of the cases have been asymptomatic or very mild. Mira Vista has been following all CDC protocols and has implemented the state protocols. This is one of the main sources of our large increase of cases in our county recently. This morning, I spent time with the city department directors. We met virtually and we talked about these uncertain times and the challenges of COVID-19 and how to continue to deliver services and provide opportunities for public participation. We're committed to the health and the safety of our citizens and our employees. This is always the compass we use when we work for this community. We also spoke of the emotional weight of this virus and the not knowing how long we will live with this virus as a threat to our physical, emotional, and economic health. We all yearn for predictability, especially now. What we must remember during this global health crisis is to be kind to ourselves and to others. Know the uncertainty we're all feeling is real, and it will continue for an unknown length of time. So let's all lean into this and find creative solutions on how to take care of ourselves, our families, and our town. Your city council has taken on this challenge and is creating an open street and a plaza area in our central business district. This will allow us all to safely shop and visit and dine. We will do a trial run Friday evening, July 17th through Saturday evening, July 18th. And then for the months of August and September, we'll expand on this and open the area up for all of us to enjoy our summer. So today, I close with my thanks to each of you for your kind and generous spirit and for being truly a caring community with diverse voices that all want this place that we call home to thrive.